So thank you everybody for joining me today for Kinship and Caregiving in Native Communities. Today is November 24th. I'm Agnes Adekai with the Sonoran Center for Excellence in Disabilities, and I am the director of the Circle of Indigenous Empowerment, which is an initiative of the University of Arizona. So on the screen, we have our logo with the Circle of Indigenous Empowerment and also a photo of me. And so I am a citizen of the Navajo Nation, and I grew up in a small community called Tisto, Arizona. I'm Dene. Che na kai Dene nishla. Twitzoni bashichin, touchini dashiche adataba dashnella. And I just stated who my clans are, my 4 clans. And so hopefully there are relatives listening on today. So before we start, just some housekeeping rules. Today's session is being recorded, and all recordings and materials will be available after captioning by email. If you'd like to ask a question, please type your question into the chat box or use the raise hand button if you'd like to speak. If you encounter any technical issues, please send a message in the chat to the Sonoran Center, who will be monitoring the chat. And you see some postings have already been placed in the chat. Live captioning is available, and we're grateful to have Dawn as our captioner today. To access live captions, please click on the live transcript button at the bottom of your screen. And please remain muted unless you're going to speak. And the University of Arizona is on the land and territories of Indigenous people. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Tohono O'odham and the Uwemi, also called the Yaqui. So we are committed to diversity and inclusion, and the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through educational offerings, partnerships, and community service. So let's move forward for today's presentation. So with our learning objectives, after today's session, participants will define how kinship is valued in providing caregiving in Native communities. Participants will also identify and address the unique needs and caregiving realities of American and Alaska Native caregivers, also called Native caregivers. And also participants will gain an understanding of how culture impacts American Indian and Alaska Native caregivers' perceptions of care and their health outcomes. So the Sonoran Center for Excellence in Disabilities is a federally designated university center for excellence in developmental disabilities, also called UCED. So it was funded by the Developmental Disabilities and Bill of Rights Act of 2000, which states that every state and U.S. territory has at least one UCED. And we are federally funded by the Office of Intellectual and Developmental Disabilities within the Administration on Community Living. Here on the slide, you see a graphic of all the university centers on disabilities. We are one of 67 across the United States, and here in Arizona, there are 2. The Sonoran Center for Excellence, located here in Tucson, Arizona, and the Institute for Human Development, which is located in NAU, Northern Arizona University in Flagstaff. So our Sonoran Center was established in 2006 within the University of Arizona Department of Family and Community Medicine. And we work to ensure full community participation by individuals through all stages of life. And our Circle of Indigenous Empowerment provides a hub of information and resources to enhance awareness of services and supports that promote quality life for people with disabilities in the state of Arizona. So we partner and connect with 22 tribal nations and urban communities throughout Arizona. So if you're not in Arizona and you're listening out of the state of Arizona, we have here on the screen an image of our state of Arizona with the colored areas representing the federal reservations. We have one of the largest number of federal reservations in the U.S. 1/4 of our state is federal Indian reservations, tribal reservations. And we are located next to the Blue Tohono O'odham Nation and the Pasquayaki-Uwame community. And our work here would not be complete without the staff that we have as part of our Circle of Indigenous Empowerment. We have Rosa Rojas Franco. There's a photo of her on the top of the wheel here. She's our project coordinator. We have Candace Spencer, who's located in Window Rock, working closely with our Window Rock High School. Well, she's our pre-ex vocational employment vocational specialist. We have Yolanda Chatter, who's located in Tuba City, and she works at Tuba City High School and our Hopi and Junior Senior High School. And we have Tana Treetop, who's our transitional specialist and training and curriculum specialist. And so all of our staff here as part of the Circle of Indigenous Empowerment are all Native women who have lived experiences, who have family members with lived experiences with disabilities. So again, just a few slides to talk about what is disability. So any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. It can be visible or unnoticeable, and can be, again, as a condition from birth or result later in life. And the likelihood of living with a disability increases with age. So I myself have an invisible disability. I have a visual impairment as a result of traumatic brain injury. And so people are unaware that I do have a disability, but usually I use larger screens and assistive devices in reading screens and reading books for work that I do. So there are about 30% of American Indian Alaska Native adults have a disability. So we have one of the highest rates of individuals with disabilities across the US, across all ethnicities, compared to Black, White, Hispanic, and Asian. And Native people are 50% more likely have a disability compared to the national average. So this is a graphic from our Centers for Disease Control and Prevention that lists the percent of adults with disability by ethnicity. And this is another graphic that talks about the percentage of American Indians and overall US population with a disability. So Native people 55 and older have the highest prevalence rates of functional limitations compared to other folks. And due to the increase in Native older population and the high level of disability within this population and among younger people, tribal communities are also experiencing an increased need for long-term services and supports for their elders and tribal members with disabilities. And you see here that we have higher households with a disabled child, 16 to 55-year-old households, and 55 years or more. And one of the things that we have is there's a stigma of disability. This is a New York Times article just recently came out this week that talked about how many older people with disabilities do not ask for help because of the stigma. And a lot of people from my generation and older have the expectation that we tough it out and that we don't need assistance, but yet federal laws provide us assistance and we have a right to ask for accommodations in work and in life. And so that is one of the challenges that we have, is that many times we don't ask for help, but our family members do help us out and see that need. So this is a photo of Rosalind Carter, who's the founder of the Rosalind Carter Institute for Caregivers. She was the First Lady of the United States from 1977 to 1981 as wife of President Jimmy Carter. And she developed a caregiving institute. She states As I quote here, there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So caregiving is part of our life. And here in the photo, she's surrounded by caregivers that she works with through her institute before she passed. So now let us look at kinship and the strength of family and community in Native communities. And so we have here an image of a lady who is providing medication to an elderly Native lady. So we know that in November we celebrate National Family Caregivers Month to highlight those who give their all to help their loved ones. A caregiver is a person who provides care and assistance to someone who's experiencing health issues or has a disability. And we saw in our previous charts that 1 in 3 people, American Indians, have a disability. So across generations, Native families have cared for one another through connection, storytelling, and shared responsibility. Today, that spirit continues as family caregivers provide daily support to elders, children, and loved ones with illness, disability, or injury. Their care preserves not just health and safety, but the cultural knowledge, language, and spiritual well-being that sustains our community. So family caregivers really are different from doctors or nurses because they're usually unpaid family members who provide the primary sources of care. And taking care of family is part of everyday life in tribal communities. Yet the work of caregivers is not always recognized or valued. Most of the time, women, like moms, daughters, aunts, or grandmothers, are the primary caregivers. Family caregivers may manage medications, coordinate appointments, prepare meals, or provide comfort and companionship, often while working and raising families of their own. Their dedication reflects the heart of Native values, responsibility, service, and resilience. For me, caregiving taught me the true essence of love, strength, purpose, and resilience. Though the journey was not easy, ensuring that our loved ones could remain at home in their final days is an honor beyond measure, that will always stay, particularly with me, in my role as a caregiver. So this is my family of caregivers. So I have 3 photos here. So I have on the left-hand side is a photo of me in my younger years with my great-grandmother, Annie Begay, who lived to be 103. And our family provided her caregiving when she was unable to stay in her community in a rural part of the Navajo Reservation. The middle picture is of my mom, who's myself wearing the red knitted hat, and then my great-grandmother, Annie Begay, when we would visit her. So I learned about caregiving early on from modeled care that was provided by my mother, who cared for her own mother and her aunts. And she ensured that we would go visit our elders and instilled in us that we needed to take care of our elders because they took care of us when we were younger. And so we'd go visit my great-grandmother frequently in her hogan. And you see here like a wood stove, and you see her wash bin there. And one of the things we do as Native people is that when we have our own wash bins and our own cooking utensils and pots, we use a nail polish, usually in red, to put our initials on there so that we know which one is ours. And so her wash pot had AB for Annie Begay. And on the last photo is a picture of me as a toddler with my oldest brother, Elmer. And so growing up, family caregiving was part of our kinship network. You know, we had brothers and sisters who took care of us when our parents, our guardians went to work. We had aunties who were there. So my aunt Sarah's there with my sister and one of my cousins. And so we had family caregivers that were part of our family. And my oldest brother was my primary caretaker, and he raised me up as a toddler. And later on, he provided support and guidance when I was a teenager and later on in life. And so caregiving is part of who we are. It's instilled in us, and we caregive for our communities and our family. Okay, so who are caregivers? According to the Association of Retired People, caregiving is the invisible backbone of our health system and economy. 63 million caregivers are in the United States, a 45% increase over the past decade, with 80 million expected by 2035, which is close to 10 years from now. And in this report, nearly half stated that they suffered negative financial impacts, and 1 in 5 experienced poor health as caregivers. So overall, family caregivers deliver 36 billion hours of unpaid care, valued at 600 billion annually. This is unpaid work that families do to provide care for family. And caregivers are also working at the same time. Caregivers are constantly switching between multiple versions of themselves, the work version and the caregiver version, quietly holding everything together at home. So at least 75% of employees are, again, taking care of a family member. And many times they do suffer symptoms of depression, and often intensified by isolation. And the isolation and the loneliness accelerates burnout. It's invisible, and it's also compounds and can be costly to the individual. So caregivers feel lonely and many times consider reducing or leaving the workforce. And so we really need to strengthen the social infrastructure of our society in order to provide caregiving for our families. An example would be my cousin, who took care of a lot of family members, and that was her primary sources of work, and she would supplement that with janitorial work in the small community she lived in. And so she provided, I would say, for 10 of our Native elders. And right now she currently works part-time and takes care of her elderly mother, my aunt, who is close to hitting her 90s. And so she really doesn't take a break that much, and that's one thing we really need to consider. We also need to think about the mental health aspect. So this is a report from the National Alliance on Mental Illness, and they state that 8.4 million Americans provide care to an adult living with a mental or emotional health condition. So again, when we think about disability, we think about physical disabilities, but we also need to think about mental or emotional conditions that our family members have. More than 1 in 3 working caregivers say balancing work and care is their biggest stressor. 47% of caregivers report increased anxiety or depression in the past year, and 52% of organizations do not keep track of their caregiving demographics. And there will be a link to the National Alliance on Mental Health Illness in the chat in a bit. So. There's the report from the American Association of Retired Persons, Home Alone Revisited, where they talk about family caregiving providing complex chronic care. They talk about how multicultural family caregivers are more likely to experience strain and worry about making a mistake regardless of income. Being a caregiver is hard work. They help with medicine, wound care, and medicinal and use medical tools. And so many times the caregivers must learn to do these things independently without taking class or getting formal training. And so, again, there's a worry about making a mistake when you're caregiving for your family member. Again, going back to my cousin, she was through the Navajo Nation Shahart program. She was actually trained in first aid, and she was able to do basic first aid. But when it came to taking care of someone who had Parkinson's and challenges with dementia and Alzheimer's, her ability was strained in that many times she didn't know what exactly she would be doing to make sure that the person was safe. And again, there needs to be more training for our individuals who are caregivers. And it's an issue for both men and women in my family. My cousins, male cousins, have been caregivers to their fathers and mothers, many times due to the fact that there's not much employment, and they also have a really strong connection to their parents. Again, but then complex care across generations and cultural groups. And many times the challenge is that in rural communities, when the weather turns, a lot of the individuals end up being placed in homes in the border towns or urban areas. Because if they needed immediate care, it'd be very hard for emergency personnel to visit these communities. Now, specifically for American Indians, this is an infographic from the Indian Health Service. They state using the 2015 to 2018 Behavioral Risk Factor Surveillance System called BRFSS. And so they state that 1 in 3 American Indian Alaska Native adults are caregivers, and over half provide care for at least 2 years. Nearly half have provided care for at least 20 hours per week, and many times they're working. So again, this is in addition to working. And most of them are women. 60% are women. 16% are 65 years or older themselves who are caregivers taking care of an older person or a younger person. We've seen that grandparents are also taking care of their grandchildren or are guardians for nieces and nephews. And many times they're also caring for a parent in-law. So they manage over 80% of household tasks and over 50% of personal care, meaning that they provide bathing and feeding and clothing a person. And again, we're seeing as our population ages and increasing number of disabilities, we'll have more caregivers needed in the future. Now, an updated statistic is that in 2021 and 2022, the purpose that 1 in 4 American Indian Alaska Natives are caregivers now. Okay. So let's take a look closely at Arizona. Again, if you're in another state, there are databases that you can look at to gather information about caregiving in your tribal communities. And again, this is not by tribal, it's not tribal specific. This is aggregated data of all the tribal information to provide tribal totals for the state of Arizona. It's called the Aging, Independence, and Disability Data Portal. So this is the 2023 tribal totals by state. So in 2023, there were 295 caregivers to children under the age of 18. For those caregiving 18 to 59 with disabilities, there were 84. And those who are providing caregiving to elders and individuals with Alzheimer's and related disorders, it was 144. So again, this is numbers that we talk about in terms of caregiving in Arizona. And this also is information from the same database. unduplicated number of caregivers providing respite care. So again, respite care is care that's provided for the caregivers. So here in the state of Arizona at 2023, respite care to elders or to folks working with Alzheimer's, there was 3. Respite care for those working for that care for people 18 to 59 was 8. And then respite care for those who are taking care of individuals under 18 or 22. So these are really low numbers, meaning that we are not providing respite care to our individuals who provide care. Again, I'll provide this link in the chat. Okay, let's move forward. Oops, sorry. So when we do caregiving, we really need to think about the cultural values and preferences in caregiving. Native American caregiving prioritizes family and community, viewing elder care as a cultural responsibility rather than an institutional one. So when our elders are older, there's always the talk of having someone take care of an elder and not sending them to an old folks home or assisted living facility, long-term care facility, because it was our responsibility to take care of our elders. Unlike typical U.S. elder care systems, which often rely on nursing homes or institutional settings, Native American families traditionally provided care at home. This conveys honor to the elders and helps preserve the connection between generations. So caregivers often face challenges like geographic isolation and financial strain and burnout, but support programs exist through tribal organizations and the Administration for Community Living to provide services such as respite care, training, and counseling. Again, we are looking at care that integrates traditional healing, storytelling, and cultural practices, with family members and tribal members being the most preferred caregiver. So caregiving is a family and community duty, with elders respected for their wisdom and role as cultural stewards. So we're looking at home-based care. Many families provide care at home to maintain generational connections. And this is where intergeneration teaching takes place. When I go back to my great-grandmother, Annie Begay, who stayed in Winslow with us at the time, and my cousin was a primary caregiver. We had many children there, young children who sat and talked to her, tell stories, who made traditional food for her, and who were just there to care for her. And that was such a beautiful experience for the little kiddos in her family to have an elder in the family. Elders often prefer that care includes traditional healing, storytelling, and practices like herbal medicines. And so when she stayed with us, my great-grandmother, she was provided traditional foods. And so blue corn mush is a staple in our community, which is blue corn meal ground and boiled and made into a porridge. And so that was what she was fed and what she preferred. She also preferred Indian tea, mutton and corn that was softened a little bit with broth. And so she was able to be provided meals that she really enjoyed. And again, preferred caregivers, families of first choice, followed by members of the tribe, and culturally trained caregivers as a last resort. And again, having respect in communication. So many times elders have different communication styles, which can be misinterpreted by non-native providers. And it's really important for our family members to be able to provide care, because you know the nuances of taking care of grandma or grandpa or an elder or someone in your care, even young children, and talking to them in the native language is really important. And then integrating traditional medicine. So we have a long history of using traditional medicine and healing, such as herbal remedies. So when my great-grandmother fell ill a couple of times, we had herbal medicines that were made by a traditional healer that we put on her limbs to help deal with the pain. When she was having trouble sleeping, we'd put ash on her feet or on her underneath her eyes. And so we did a lot of activities to help her at ease. We also had prayers, and many times we had we would have many blessings for her while she was with us to address, some of the physical, emotional, and spiritual needs for her. So really, it's important to be able to provide the traditional medicine and spiritual care for folks. And it is also really important to integrate that into any assisted and long-term care services that's in that tribal communities and urban communities provide. So some of the challenges, as I've mentioned earlier, were many caregivers live in rural areas with limited access to services, transportation, and support networks. So again, being far away from hospitals or clinics means you can't get immediate medical help. You have to drive long hours to appointments, pharmacies, rehabilitation centers. And many times because of that, you have to give medications such as injections to folks if at home. And many times you have to do medical interpretation too as a caregiver when you do take them to facilities. So as I said, my great-grandmother lived in a really remote community, which was impassable by vehicle when it rained. And it got really slushy and was impassable. So that's why she ended up living with our family. And her home was only heated by a wood stove, and which depended on someone to help build her fire, warm her water for her, and make her food. And it was really inconsistent with people living with her because most of her son worked at the time, and then her grandchildren were in school. So the best option was for her to live with our family, so that she'd be in an urban area and closer to the hospital. Again, financial barriers, affordability of care and services is a significant challenge for families. All of this is unpaid work. So if we were to pay for somebody, that would be a significant challenge for folks. Just like childcare for an infant or a child, it ends up being the majority of your budget if you had to pay for someone to provide care. Or if you sent someone to an assisted living facility or long-term care, the cost is really extreme for a lot of folks. Burnout is also a challenge, leading to physical and emotional stress of the person. And many times, the caregiver ends up being the only caregiver. Although there are other families that members can step in, there's always the perception that the caregiver is the only one that can provide care. But then respite care is really needed for a caregiver. And of course, there's health disparities in terms of, the fact that healthcare providers are very few, and there's lower quality of care, and many times a historical distrust of healthcare providers and a distrust of hospice and palliative care. Just less than a percent, like 0.4% of Medicare patients who received hospice care in 2017 were Native Americans versus 83% of Medicare patients receiving care who were white. And this is from the National Hospice and Palliative Care Organization. Again, we're not utilizing services because we mistrust what hospice means and what palliative care means. And does it mean we have to send our folks somewhere else, or could it be something in-house? Again, there's that mistrust of what this means. And as we move forward in what kind of services that can be provided in tribal communities, the mistrust of agencies, the mistrust of sending people to assisted living or long-term care facilities that are not operated by tribal communities, there has been a movement for funding for assisted living facilities in tribal nations, which provide culturally appropriate long-term care, including integrating traditional Western medicine and community connections to family. And so this is a image of a map of the CMS region with tribally operated nursing homes and assisted living facilities. So in the United States, we have 23 tribally operated nursing homes and 14 tribally operated assisted living facilities. And they are operated by many tribes and many times are found in tribal lands. And they provide services just like any facility, the daily meals, medication, transportation, and services that link to cultural beliefs and culture of the community that they live in. So they do provide culturally focused care, offering nutritional healing and practices, and emphasize that elders need to be connected to their communities and families, and include and encourage families to be involved in the care and the social activities that some of these facilities have. So I've, in the state of Arizona, I've worked and visited the Tohono O'odham's Archie Hendricks assisted living facility in cells on the Tohono O'odham Nation, and as a community member, we provided games and blankets and other gifts for the elders who stayed there. And when learning more about the facility, they provided times when family members can come visit. They encourage connections with family members through iPads. They have storytelling nights. So really connecting to their community. They have a lot of individuals who work there who speak the O'odham language, who can speak with the residents in their language, and provided meals and entertainment, art-based activities. It was a really well-rounded care facility for folks in their community. Again, we using tools such as video calls, and then providing storytelling and traditional activities and ceremonies in these facilities are really important to provide care for family members when the option is placing your elder person in an assisted living facility or a nursing home. There are other models that are also important. Again, most of the information I have is focused on elder care because that is mostly what I'm familiar with. Indian Health Service is the health care provider for tribal communities across the U.S. There are service units, regional areas that provide services to different parts of the United States. And again, this is services that are required as a government relationship with tribal communities in the United States. So the Indian Health Service has an Alzheimer's grant program within the Office of Clinical and Preventive Services. And they created models of dementia care that help meet the needs of tribal communities. And here on this map, we have a map of the United States with different highlighted centers that provide dementia care. So here in Arizona, we have Tuba City Regional Healthcare. In 2024, in New Mexico, there are a couple. We have some in the Northwest area, in the Midwest area, and central part of the United States. And many times these are facilities that are located in heavily populated tribal communities. Providing culturally sensitive and effective models of care that improves the lives of those living with dementia and their caregivers. And again, located in community organizations. Indian Health Service also has another program, which is the Dementia Extension for Community Healthcare Outcomes, which is called ECHO. It's part of the Indian Country ECHO program, which is a model program that provides Zoom or telephone services on presentations on case studies of various health areas. So in 2023, Indian Health Service Alzheimer's Grant Program partnered with the Northwest Portland Area Indian Health Board's ECHO program and developed 2 ECHOs that were focused on the clinical dementia of ECHO and for medical professionals, and then dementia caregiver support for people who help care for individuals living with dementia. And these are two great programs. The dementia caregiver support one is open to people. You just need to sign up for them, and every month they have information on dementia care, which is really important for caregivers to be up to date on information. Success story here in Indian Country. This is the Aging Well with Cherokee Indian Hospital's Elder Care Specialty Clinic with Dementia Echo. So again, we have here on the image here, a physician, Dr. Blythe Winchester, is talking to a patient. And she is a member of the Eastern Band of Cherokee Indians and directs the geriatrics at the Cherokee Indian Hospital in Cherokee, North Carolina. And she was the spearhead behind developing the Dementia Echo. And in her practice at Cherokee Indian Hospital, they work closely with one of their long-term assisted facilities to provide care for elders, and they make house calls and make sure that the care provided at their center is connected to the care at the assisted living facility. So they do have that elder specialty care clinic. So again, that's one success in how they're able to partner, and the physicians are able to partner with the assisted living facility to have continuity of care for elders. Another one is, this is an exciting program that I was made aware of, where they talk about poetry for elders with dementia as a way to express themselves. So the Memory Keeps Medical Discovery Team poetry intervention at the Fond du Lac Band of Lake Superior, Chippewa. So this is a beautiful example of acknowledging kinship and caregiving. So it's a poetry program that helps Native elders with dementia remember Indigenous traditions and stay socially engaged. So the poetry sessions counteract the isolation, loss, and stigma that can creep into the lives of Native elders living with Alzheimer's, and emphasize the valuable role in the community. So this is a very beautiful program. Promotes brain health, and while recognizing that elders are keepers of songs, stories, rituals, and their wisdom can benefit others. And so in this slide here, we have on the upper top photo is of an elder surrounded by other folks who are part of the program. And then on the bottom is an individual who's participating in writing a poem. And so family members come with their elder and help to relive some of the stories and write them down in poetry. So it's a great way to focus on storytelling and community. So again, one of the things we need to focus on in terms of caregiving is really understand and be aware of the current realities of family caregivers, health professionals, healthcare delivery systems, and policymakers. And again, community-based organizations should include in their programs and services resources that address the needs of all family caregivers, particularly those engaged in complex care. As we've seen in previous slides, a lot of our caregivers are providing medical care and many times are not trained, and there's the fear of making mistakes. And so looking at expanding and providing training for our caregivers, or providing individuals who are trained to provide that care as well. So thinking about what services can be provided. Again, recognizing family caregivers and support for giving complex care, because burnout is a reality among individuals. My cousin, who's been taking care of all the family members, has really had few opportunities to really take time for herself. And so, you know, we try to provide respite care as needed, provide opportunities to take a vacation, to really wind down. And then when an elder does pass again, the weight of having someone pass in your care is also a challenge for folks, which many times is not talked about. And for her, She is strong in her faith of prayer, and so she prays and is grateful that she was able to provide care for the individual. And so at family gatherings and meetings, we recognize her service and recognize her with gifts. And but still, burnout is real for a lot of folks who are caregivers. So these are some resources that would be maybe helpful for you. National Alliance on Mental Health, the Family Caregiver Helpline. These are numbers. They have a 1-800 number. They also have a text. You can also email. The helpline is available Monday through Friday from 10 to 10. And then resources can also be found at NAMI.org/family. So this is a resource that can be utilized. A couple partners. We have the National Resource Center on Native American Aging. They have a Native Elder Caregiver curriculum. That is the image you see on the left-hand side. In the middle, they have the Native Elder Caregiver module. Again, it's designed for family members providing care for older adults. And then on the right-hand side is a photo of a module on normal age related and expected changes in aging. Again, training folks to know what is normal aging versus maybe Alzheimer's and dementia. They also have other resources such as the needs assessments on identifying urban elder needs, and then urban elder service locators. So these are resources that may be helpful to you. And other partners, the International Association for Indigenous Aging has a caregiver section. And our last webinar, they presented on the Wandering Toolkit. They have the National Indian Council on Aging. Their caregiving pages has information, a wealth of information on caregiving, justice and aging, supporting tribal elders through home and community-based services, has information there as well. And then another partner, Sutso Foundation, does training here in Arizona and New Mexico on cross-generational caregivers. And they recently presented at one of our health equity conferences here in Arizona. She did a wonderful job in explaining caregiving and the expectations and the challenges in a realistic framework. So if you have any questions or would like to contact me, this is my contact information. I am, again, Agnes Atikai. My email is agnesa@arizona.edu. Okay. So if there are questions, please let me know. I will put on my video, and if you have questions, and I'll stop sharing my screen. And I'll also put some of the resources that I had mentioned in the chat. So I'm putting the Rosalind Carter Institute for Caregiving information, the link to the Institute on Aging as well. Link to the National Alliance on Mental Illness report. And then the infographic from Indian Health Service, which is a wonderful website where I was able to use some of the resources and information from their website for this presentation. Okay. And then the CMS Tribal Home Directory. I was there. The link to the Dementia Care Echo program. which I really highly recommend their ECHO program. They have other echoes on other health topics as well.
Hi, Agnes. This is
Yes.
Bjorn. Very well done today. So I really appreciate not only sharing the data and information, but some of your personal experience with being a caregiver that I think many of us have that experience of being a caregiver and an advocate and whatever we need to be for our family members. So that's something that's even more prevalent, particularly in our tribal communities that you grew up in, and other tribal communities have similar challenges that if we're not there as family, there's not much other availability of services and support. So thank you for identifying the family connection and the need in many of our tribal rural communities, but just also that personal connection to being a family caregiver and what that means to us in Indian country. So thank you for sharing that. Good job, by the
Yeah, thank you. I can tell you more stories, but I have to be careful how much
way.
I can share.
Yes, I have a
Uh,
similar. But
because
anyway,
caregiving is a really hard work. There are times when the person who you're caregiving for will be cursing you out, will be telling you all sorts of stuff, will be angry at you, and you're trying to provide care.
yeah. And
And you're
my mom's Pat, she went through dementia, and so that was some of those challenges with her, and then just so many different challenges with all the different disabilities. So thank you for
uh,
sharing those different resources for our folks joining us today, so they can have a little bit more access to more services, not only for them and their families, but for others. So
Yeah, I remember a time when we were taking care of my uncle's mother who had Parkinson's at the time and Alzheimer's, and she had a wealth of issues, and she'd also have hallucinations. So she would always think about things were happening in the room. And at first we were saying, well, isn't she having these hallucinations? Then later on we realized that she was remembering a lot of things. And so we just went with it and we just talked with her. So, oh yeah, okay. She would talk about seeing sheep there. Who's taking care of the sheep? And I said, oh yeah, so and so is still taking care of the sheep. The sheep are okay. And just going with it and just relating to her really helped relieve her instead of arguing with her and telling you're not seeing things, you're hallucinating. That was the wrong way to do it. And so there was a lot of things we learned on our own to help with that situation. She was also notorious for not taking her medication.
yes.
And elders are very sneaky. And we tried very different ways to try to hide her medication, like putting it in pieces of bread, putting it in like a sweet treat. Sometimes asking the doctor and the pharmacist if it was okay if we could grind the medication out, because sometimes you grinding it is not really good. It can absorb through the blood faster. So
Mhm.
some we were able to grind and put in her porridge, but she knew she would give it to her and she just had that look on her face. I was like, I know you guys are giving me medication here. I can taste it. So that was always a challenge trying to provide medication. So
Yeah, and that's similar with our experience as well. And that's that fine balance of respecting them as the elder as well as, you want them to have some control in their life, but at the same time, medically they need some of this. So it's difficult. So thanks for bringing up that the caregivers need to make sure they're taking care of themselves as well.
mm, yeah. And even though I talk mostly about elder caregivers, I just barely glossed over how elders and grandparents are taking care of younger children,
Mm,
grandchildren, maybe guardians. And so that's another aspect of caregiving is taking care of a younger member, and being responsible. And many times they're providing care and are not the legal guardian of their charge there. And so that becomes a difficult in terms of interacting with schools or with medical facilities because they're not considered the legal guardian. So that's also another issue of grandparents is that they take care of their grandchildren or the young people, but they don't have the legal papers, and that
Mm,
becomes a challenge for folks.
yeah.
Okay, so are there any other questions that we have here? So I think there's just so much information that's now provided on caregiving. When I was caregiving back in the late 80s, there was really nothing available. But now there's a wealth of information because there's just such a need for resources. Um, Julie Arman just posted in the chat a PDF of a file called the 2026 Annual Caregiving Summit, Caregiving with Courage. That's going to happen February 24th, 2026 in Desert Willow Conference Center. And if you open up the PDF, there's a QR code that you can do to, actually that's expired, but registration is coming soon. So
Hi, Agnes. Ja, Bene.
hey, Carol, sister,
How are you?
I'm
Great
good.
presentation. I just wanted to add, as you're talking about caregiving, going back and thinking about our experiences when we're young, yeah, and children have to step up and become caregivers as well, taking care of, contributing and helping with grandma and
Mhm.
just any member in the family. So I was just thinking maybe we should think also about developing some training for them at an early
Mhm.
age, give them some tips and invite them in also and just train them a little bit so that they're more aware, especially those that are responsible for taking care of grandma that has dementia or whatever.
Mhm.
Irea. Thank
Thank
you.
you. Yes, thank you. That is really a great point because as I said in the earlier photo of me, of my mom making sure we knew that responsibility. She'd always take us back home and we'd take care of our elders. And from both my parents, my mom and dad, they kept telling us that when it's always important to take care of your grandparents. When you go home, make sure they have water, make sure they have chopped wood. If they're even though it's getting, they're not cooking something, make sure you cook something for them because they might be hungry.
Mhm.
If you see that they're running out of food as you get older, this is when we became teenagers and adults. If you
Mhm.
see that they don't have any food, make sure you buy food for them, and
Mhm.
they would really greatly appreciate them
Yeah.
because they spent their life taking care of us. He said,
Yeah.
our grandparents, many times had to work and provide food and care in a not modern society where there was just so many things they had to do on their own. And so being respectful of them and providing that care, we should be caring for them. And so I really agree that young kids should be able to uh, provide lessons on how to take care of elders, but
Yeah.
also understand that maybe grandma and grandpa may be not seeing things, hallucinating
Yeah.
there a little bit, like I said in the older
Oh,
my
yeah.
uncle's aunt, and understanding that, yeah, maybe
Yeah.
she sees something a little different, but that's okay. She's telling a story. So yeah, I see your point there. And thank you
Yeah.
for that, Carol.
Oh, yeah. Thank you.
Okay, it is at the hour now, so thank you very much for joining us for today's presentation on kinship caregiving in Native communities. We will have more sessions in the future on caregiving. We're going to have Soul Foundation talk about the trainings that they offer and more coming up within oh my gosh, it's like this going to be December soon. So probably in the springtime, January, we'll have more webinars on caregiving because this is a topic that we need more information on, and other organizations are doing wonderful work that need to share their information. So again, thank you very much for joining us, and remember to provide us feedback. There is a link to our survey about today's webinar. Please fill that out so that we can gather more information on what topics we would need to explore. And when the webinar recording goes out, we'll have the resources available for you that we talked about. Again, thank you very much. And happy family time this week, everybody. Thank you.